Welcome back to the National Defense. It's Randy Miller. And, we love talking about the VA, one of our great partners and friends here in the program. And it's always great to have some great news about the VA. And we got some more good news. This is pretty sensational. For the second year in a row, VA hospitals outperformed non-VA hospitals in two major nationwide reviews for care quality, patient satisfaction. And here to talk about it is Dr. Shareef Elnahal, the Undersecretary for Health at the Veterans Health Administration in the Department of the VA. Dr. Elnahal, how are you?
Thanks so much for having me, Randy.
Hey, this is great news, huh? I mean, 2 years in a row, that certainly says a lot about the care that our soldiers and airmen and military people are receiving.
It's so true, and many of your listeners are still serving on active duty or in the reserves. And the message I want to send to them is that VA really compares well and often exceeds the quality of healthcare offered at many of the other options they'll qualify for when they transition back to civilian life. About 58% of VA medical centers score either 4 or 5 stars, the top 2 ratings out of 5 in VA, as compared to only about 40% of private sector institutions. And when it comes to a star rating focused on patient experience, 79% of our medical centers score in the top 2 ratings, 4 and 5 stars, compared to only about 40% again of private sector institutions. So folks should be armed with all the information they need to make the right choice for their health care, and we're really thankful for our care teams across the country who've achieved these great results.
Yeah, we're talking to Dr. Shareef Elnahal, Undersecretary for Health, Veterans Health Administration for the VA. And let's go back to some of those numbers, if we can, for just a second, Dr. Elnahal. It's great that you guys have scored better, but then when you look at 58%, it's I don't know what kind of a statement that is, that's the best that we can do. But then you put that up to other non-VA hospitals at only 40%. What do you think about those numbers? What does that say to you?
Well, the first thing it says to me is that we have a lot of room to get even better. And that's our focus and that's our mindset. We don't rest on our laurels with these results. Just because we're better than the rest of American healthcare on average doesn't mean we don't have room to grow. And that's a really important mindset we've instilled across the country. And we have a lot to do to make sure that we have even more 4 and 5 star facilities next year. I am proud, I'll say, of what veterans tell us about their care. And the 79% of our hospitals scoring at the top 2 levels on patient experience in the inpatient setting, and 92% of veterans who tell us that they trust VA for their care after experiencing care in one of our clinics. We have a lot to be proud of in terms of prioritizing the veteran experience. But again, we will not be satisfied until we hit 100% on those scales. And that's our mindset, and that's how hard we're going to work into the future.
Yeah, we talk to a lot of veterans on this show about their care at the VA. And as you know, Doctor, veterans are very vocal, both ways, positive and negative. But I would say, golly, for the most part, everybody I talk to that gets treatment from the VA, they just rave about it. They rave about it, and not only the patients. I want to say something about the employees at the VA. I just talked to a young lady the other day at a dental office, and she used to work at the VA dental office, and she said, if I ever have a chance to go back, I will. She said, that is the best job in the world. So that's got to make you feel pretty good.
It does, and I think the most likely reason she said that, Randy, is because the patients are the best. I mean, veterans, far and away, were my favorite patients going through medical training because they're such incredible people. They've obviously sacrificed a lot to serve the country, and somehow they end up becoming the most grateful patients, despite the fact that they've earned this care. And that's really how we view it in the VA. And about a third of our employees are veterans themselves. They've served and understand the experiences directly of the patients that are coming in. But so many more of our employees, Randy, have a veteran in their lives and really take the mission so personally, on top of being at the top of their game in their field.
Yeah, there's a grizzled old Marine buddy of mine that will just tell you all day long about the care that he gets at the VA. And that trust factor that you mentioned is very high in the veteran community, especially with this guy. We're talking to Dr. Shareef Elnahal, Undersecretary for Health, Veterans Health Administration at the VA. I want to talk about your background just a little bit, if we can. How interesting. Moved to the United States from Egypt, the son of physicians, and worked in Newark, I guess?
Yes, Newark, New Jersey.
Yeah, and has been very involved in reducing the opioid epidemic as well.
Yeah, I've had the chance, Randy, to serve vulnerable people my whole career. I'm trained as a physician, but I've held honored to have held different leadership jobs throughout my career. VA has been a big part of my story, and I've had a lot of reasons to try to serve vets in my career. As I said, my favorite patients coming up through training. But also, when I was running a hospital in Newark, it was a safety net institution for really vulnerable folks living in the city of Newark. When the COVID pandemic happened and we needed U.S. Army Reserve clinicians and active duty U.S. Army a second time to come to our institution after about a third of our nurses had to be out because of COVID. They came in, they integrated with our team, and they saved lives in our community. And I remember one of the commanding officers, I asked him what I could possibly do to repay these incredible people in uniform. And he said, look, I looked you up. I know you've served in the VA before. Get back there and serve again, because everyone who served with you during this pandemic will become a veteran one day. And so that meant a lot to me. And as it happens, I was able to come back and lead the healthcare system for veterans, and it's been the honor of my professional life.
That's so cool. Hey, there's a lot of talk right now about psychedelics, especially in the veteran community. Where does the VA kind of stand on that?
Our clinicians and scientists and researchers see a lot of promise in psychedelics. And I know that the FDA looked at a particular application for MDMA and decided not to approve it recently. They identified a lot more questions that need to be answered when it comes to the science. And so we are funding studies for the first time out of the VA to investigate agents like MDMA, psilocybin, which is the active ingredient in magic mushrooms, as it's called, and other psychedelics, to understand what the benefit can be for really tough to treat conditions like PTSD and major depression. So that funding should be coming out in the next couple of months, and we're really excited to discover the potential of this exciting new line of therapy.
Yeah, I think so too. I think that is so good, and so necessary right now in some of the new information that is coming out. Talking to Dr. Shareef Elnahal here, Undersecretary for Health at the Veterans Health Administration. So thank you so much for your time today. Congratulations on the reviews for the VA. And the next time we talk to you, will you be the governor of New York?
I will not, because I'm not from New York. I'm from New Jersey. But also, I plan on serving vets as long as I possibly can, Randy. But I appreciate being on your show. Thank you so much.
Thank you so much. We'll be right back here on the National Defense.